This presentation is part of our cardiologist series at the Veterinary Channel. Today we are going to discuss a heart condition in Doberman Pinschers known as occult cardiomyopathy. The presentation is based on the writings of Dr. Rebecca E. Gompt, a veterinary cardiologist. Occult cardiomyopathy is a slowly progressive heart muscle disease that results in abnormal heart rhythms in Doberman Pinschers. Because this condition produces arrhythmias, often ventricular premature contractions and ventricular tachycardia, it is also called arrhythmogenic cardiomyopathy. Dobermans suffering with this condition may have no clinical signs for a long period of time, which is why the disease is referred to as occult. Eventually the dog develops arrhythmias and, later, dilated cardiomyopathy. Occult cardiomyopathy runs in families of Dobermans, so a genetic factor is involved. It can be traced back to the original 7 sires of Doberman lines in the United States, 3 of which died suddenly when they were middle-aged. The exact gene or genes causing occult cardiomyopathy have not yet been identified, but it may be an autosomal dominant characteristic. Occult cardiomyopathy starts as early as 9 to 12 months of age, but most dogs are diagnosed between 2 to 4 years old. By 6 years of age, about 50% of Dobermans have occult cardiomyopathy. Most dogs with occult cardiomyopathy have no symptoms. Their arrhythmias may be detected on a routine physical examination or on a screening electrocardiogram or holter monitor study. Dogs with more frequent ventricular premature contractions or ventricular tachycardia may have fainting episodes, also known as syncope. About 30% of dogs died suddenly, without previous clinical signs of the disease. Older dogs may have exercise intolerance. Since occult cardiomyopathy is very prevalent in Dobermans, annual screening of adult dogs often starts at 2 to 3 years of age, and may include a 24-hour holter monitor and echocardiogram study. The likelihood of finding ventricular premature contractions, ventricular tachycardia, or echocardiographic changes increases as the dog ages. Once arrhythmias has been found, the only way to diagnose occult cardiomyopathy is to rule out all other possible causes of ventricular arrhythmias. Routine laboratory tests, chest and abdominal radiographs, thyroid hormone tests, an echocardiogram, and possible other tests may be recommended. If ventricular tachycardia, severe ventricular contractions, or fainting are occurring, it may be necessary to hospitalize the patient for treatment with intravenous drugs. The more severe the arrhythmia, the greater the chance of sudden death. Once the patient's heart rhythm has been stabilized, it can be managed on an outpatient basis with the use of several different drugs, alone or in combination. No, every drug works in every dog, so sometimes a dog must be switched from one drug to another to control the ventricular arrhythmias. Oral drugs that are used for controlling ventricular arrhythmias caused by occult cardiomyopathy include the combination of MEXILETINE and atenolol, MEXILETINE and carvedilol, sotalol, or MEXILETINE alone. If the medications previously mentioned do not control the arrhythmia, then a combination of MEXILETINE and sotalol may be tried. The drug amiodarone is used as a last resort and often requires referral to a veterinary cardiologist for its administration. The side effects of antiarrhythmic drugs include lethargy, anorexia, vomiting, and diarrhea. These side effects are more common with the use of MEXILETINE. Occasionally, antiarrhythmic drugs can make the arrhythmia worse, so the patient must be switched to another medication. Amiodarone has multiple side effects, including liver damage, decreased white blood cell counts, and damage to the thyroid gland. Affected Dobermans require frequent electrocardiograms until their ventricular tachycardia and ventricular premature contractions are controlled. Ideally, a holter monitor is applied to dogs with non-life-threatening arrhythmias to document the frequency of the arrhythmias prior to treatment. Another holter recording is done after the drug has reached adequate blood levels, to judge how effective it is in controlling the abnormal beats. Affected dogs require antiarrhythmic therapy for the rest of their lives. Echocardiograms may be done at every 6 to 12 months to monitor for evidence of dilated cardiomyopathy, which can follow occult cardiomyopathy. Dobermans with infrequent ventricular premature contractions that are feeling well usually develop changes in their echocardiograms within 1 year. Within 2 years, their ventricular premature contractions and heart changes often get worse, and 30 to 50% of these patients may die suddenly. Dobermans with severe ventricular premature contractions and ventricular tachycardia that are well controlled with medication can live up to 1 year or longer. No drug is 100% effective in preventing sudden death. The better the arrhythmia is controlled, the less likely it is that sudden death will occur. Holter monitors provide the best way to evaluate how well the medications are controlling the arrhythmias. If dilated cardiomyopathy develops, the patient's lifespan is only weeks to months, an average of 3 to 4 months. Because occult cardiomyopathy has a genetic basis and runs in families, it is wise not to breed Dobermans that have the problem. Once again, this video was based on the writings of Dr. Rebecca Gumpt. Dr. Gumpt is a veterinary cardiologist. Subscribe to the Veterinary Channel for more informative videos. This video was optimized for the following phrases. Cardiology series. Heart condition in Dobermans. Abnormal heart rhythms in Dobermans. Arrhythmogenic cardiomyopathy. Dilated cardiomyopathy in Dobermans. Occult cardiomyopathy of Dobermans. Doberman lines in the United States. Holter monitor study. Fainting episodes in Dobermans. Syncope in Dobermans. Exercise intolerance in Dobermans. Echocardiogram study in Dobermans. Ventricular arrhythmia in Dobermans. Ventricular tachycardia in Dobermans. Ventricular contractions in Dobermans. Sudden death in Dobermans. MEXILETINE and atenolol combination. MEXILETINE and carfentanil combination. Sotalol for the treatment of occult cardiomyopathy. Amiodarone for the occult cardiomyopathy. Abnormal heartbeats in Dobermans. Antiarrhythmic therapy. Breeding Dobermans with dilated cardiomyopathy. This video belongs to the cardiology series of the Veterinary Channel. Occult dilated cardiomyopathy is a heart condition in Dobermans. This heart condition produces abnormal heart rhythms in Dobermans. Occult dilated cardiomyopathy is also known in the veterinary literature as arrhythmogenic cardiomyopathy. Occult cardiomyopathy affects Doberman lines in the United States. To diagnose occult cardiomyopathy in Dobermans, a Holter monitor study is required. This heart condition produces fainting episodes in Dobermans. Another clinical sign is syncope in Dobermans. One of the most common clinical signs of occult cardiomyopathy is exercise intolerance in Dobermans. An echocardiogram study in Dobermans is another way to diagnose this heart condition. Arrhythmogenic cardiomyopathy produces ventricular arrhythmia in Dobermans. Occult dilated cardiomyopathy produces ventricular tachycardia in Dobermans. Ventricular contractions in Dobermans are affected by this heart condition. One of the classical signs of occult cardiomyopathy is sudden death in Dobermans. The MEXILETINE and atenolol combination is one of the first therapies of choice in the treatment of occult cardiomyopathy. The MEXILETINE and carfentanil combination is the second choice of treatment for occult cardiomyopathy in Dobermans. Some veterinary cardiologists use sotalol for the treatment of occult cardiomyopathy. The use of amiodarone for occult cardiomyopathy is only done at the veterinary cardiologist's office. Occult dilated cardiomyopathy produces abnormal heartbeats in Dobermans. Antiarrhythmic therapy is necessary for the treatment of this heart disease of Dobermans. Breeding Dobermans with dilated cardiomyopathy is not recommended.